It's another December Saturday morning on VOB.
12 more days before Christmas.
I'm dreaming of a healthy Christmas.
If you are dreaming of a healthy Christmas, your favorite healthy radio show from the Barbados Diabetes Foundation is starting up now. Hear nutritionist Victoria Cox on
how can you make something like Jug a healthier dish.
I want to hear that, cause I like Jug bad.
Dr. Diane Braffet on
chronic kidney disease, or CKD. What is it?
A serious topic all diabetics need to hear. Plus you get a foot tip from podiatrist Louise Robinson. All this and more coming up in the next 15 minutes you hear on VOB with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Ice Screening Program, and the bank that you can bank on this Christmas and beyond, Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
But it's just again to re-emphasize the importance of good diabetic care. And the diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.
Morning VOBers, this is Peter Boyce here to remind you that if you are diabetic or pre-diabetic, don't get caught up in all the Christmas shopping and the Christmas eating and forget your health. Remember, the Maria Holder Diabetes Center located in Warren St. Michael is open all through December to serve you, whether it's diabetic eye screening, you're supposed to get eye screen every year once you're diabetic, vascular screening in case you might have bad circulation, or seeing a diabetes specialist, nurse, or doctor. There you can also find registered dietitian Victoria Cox. I know a lot of people don't like to hear dietitian around Christmas. We know how bitches like to eat at Christmas.
You know, God just be looking to eat down the place. My belly can be so big you can mistake me for Santa Claus.
Now you see, that is the wrong attitude. Let's hear what dietitian Victoria has to say about healthy eating at Christmas and also how you can make a healthy jug. This is Victoria.
When we have the conversation about healthy eating at times such as Christmas, something I just first like to remind people is that eating maybe a little bit less healthily or eating things that you don't usually eat, if only on one day, is less likely to have significant impact on your overall health. However, it's when we sort of drag this, Christmas eating out over the whole month of December, so starting from Independence right the way until after New Year's, that the additive effect of this less healthy eating is going to, ultimately affect our health. And so it's just something to be mindful of, that you really want to try and save special dishes, special treats to maybe actually Christmas Day itself, and try and isolate these incidences rather than drag it out for the entire month. So when being asked, okay, well, how can you make something like Jug a healthier dish? I have to give the disclaimer that I am not a chef, but anytime you're looking to sort of healthify a recipe, you want to break down the components of the recipe and kind of think about, well, what are the healthiest parts that you can play up and what are maybe the less healthy parts? So at its core, you think, okay, well, Jug is going to be a dish that is based on pigeon peas. Peas, legumes, they're great for you, so that's not the problem. When you think, some of the unhealthier aspects may come into play is going to be if salted meat is used, if fattier cuts of meat like pork are used. So, again, that's going to be a high fat content, high sodium content. So the things you can kind of consider there would be, is it possible to make the dish without salted meat at all and just use fresh meat? If you do use salted meat, obviously you want to be sure to really soak it as best you can to try and decrease the sodium content. You can also consider maybe using leaner meat. So Again, I'm not a chef, but I have seen some recipes out there that substitute pork or red meat with chicken, for example, or in the very least using lean cuts of pork. So just trying to, break the recipe down into its components and think about what you can play into, aka, the peas, the herbs and spices, and what maybe you can cut down on. And again, it could just be that you maybe use less of certain meats in the dish, just in terms of shifting the proportions a little bit so that it does lean more towards the peas and less reliant on any kind of meat itself.
When I hear Victoria right, that is how you can make Jug Jug healthier this Christmas as we go into our Christmas song of the day, a song that mentions Jug Jug and other Bajan favorites. This is Jadu with For Christmas, compliments the Maria Holder Diabetes Center and Republic Bank.
Season's greetings from the Maria Holder Diabetes Center.
Christmas again in my Caribbean land. You know that we is the land of the sea and sun. You won't hear sleigh bells in the air, only church bells in the chilly atmosphere. And smiling faces everywhere you go, people real happy cause they got dough. All the bonus and the back pay ain't enough to spend for Christmas Day. We repair the house for Christmas, we change the curtain for Christmas, we bring in carpet for Christmas. Christmas is the deadline for everything. We making jobs for Christmas, we think about love for Christmas, we kiss on the heart for Christmas. On this blessed day, this is what it means. Christmas, it's turkey and ham for Christmas, it's pork and it's lamb for Christmas, sacrifice a ram. It's rum and it's wine for Christmas, sorrow when you die for Christmas, it's yours and it's mine.
Share the joy of giving this Christmas. This holiday season, honor your loved ones with a gift that truly makes a difference. Donate to the Barbados Diabetes Foundation in their name and receive a beautiful certificate of appreciation to share. Your donation will support and empower those living with diabetes in Barbados. Give health. Give hope. Give back. Call 417-0305 or email info@barbadosdiabetesfoundation.org to make your donation today. Together, let's make this Christmas unforgettable. Season's greetings from the Maria Holder Diabetes Center.
As we continue on the Maria Holder Diabetes Center radio show, it's time to talk feet with podiatrist Louise Robinson. We asked Louise to comment on what are the life expectations of a person who has had their feet amputated.
You normally only expect to live for another 5 years after that, and I can find the statistics on that. That is why we're trying to get a grip of this worldwide epidemic, because it's everywhere, on the country, on the world, and we're not doing enough prevention. So when people are having their limbs cut off, it's usually because the sugar levels have gone far too high, and then when sugar levels go high, it affects your kidneys. So it's not diabetes itself, it's one of those other conditions that kill you. It's your circulation kills you, or the infection will kill you, or your kidneys will kill you, or you'll have a stroke, and that's what happens. People forget about the feet, but once that circulation's gone, they're coming to us when it's too late. They need to be having the feet checked. As soon as they hear they've got diabetes, people should have the feet checked, along with their eyes, along with the kidneys, along with the heart, because I can guarantee it's always the feet that go first. And once that goes, and once you start losing sensation, which is feeling in your feet, you never get that back. And people are never told this. Once it's gone, it never comes back. And then it's just a downward from there.
Thank you, Louise. We just heard Louise mentioning your kidney, which leads us into our next segment with Dr. Diane Braffett with focus on chronic kidney disease.
Chronic kidney disease, or CKD, what is it? It means that you're entering into a situation where there is damage to the kidney, which oftentimes is irreversible. Chronic means that it happens a little bit slower than something that's acute, meaning that happens all at once. Many of the acute forms can be reversible, but not all. And yes, diabetes and hypertension hypertension are the leading causes of chronic kidney disease worldwide, and of course in Barbados as well. I went to a very interesting lecture last night, and if you're living both with diabetes and hypertension, obviously if not controlled, you're actually more likely to get chronic kidney disease than if you just had one or the other. Okay, so once again, it's about taking care of yourself. What are some interesting terminologies that I want you to understand or start to understand? You should be screening for chronic kidney disease based on the frequency in our population. We don't have great numbers, but some of the information is possibly suggesting that they're seeing signs of chronic kidney disease. Hold on to your seats in almost 1/3 of our population. Now that was not just stunning to me, because in our clinic, among our persons living with diabetes, we see rates above 1/3. But if you're getting that in the general population, mind you, these are not formalized results. The screening might be skewed because it might be people who have a history of diabetes and hypertension, or who have a family history of kidney disease, who are going to get screened. But what this made me realize, in a way that I want to impress so strongly, I mean I knew it, but I want to impress it on Barbados. You need to take screening for diabetes, high blood pressure, kidney disease, and the complications of diabetes seriously. Even if you're not living with diabetes, you need to screen yourself for hypertension, chronic kidney disease, and of course, pre-diabetes and diabetes. You will hear me say over and over, pre-diabetes is not a benign condition. Now, the beauty of screening for chronic kidney disease is that if you pick it up very early, there are things that can be done to reverse the process. If you pick it up late, and interestingly, too many people are picking it up too late, there is often nothing that you can do to reverse the progress, and in some cases, it will still progress on to end-stage kidney disease requiring dialysis. So that's my tidbit on chronic kidney disease for today. I'm not going to overwhelm you, but as I said, chunk-size information, and in the coming weeks, we're going to keep giving you chunks and chunks and chunks as we at the Maria Holder Diabetes Center for the Caribbean aim to help to empower you, but also we want to help you take better care of yourself. You can come into the foundation or the diabetes center in Warrens, and you can get your diabetes screening. You can get kidney screening done, which is going to be a combination of urine testing and blood testing, and also get your blood pressure and your cholesterol checks. So let's give ourselves that gift for Christmas or the New Year's, and that's the gift of health, the best gift you can give to yourself. Have a blessed weekend. Bye-bye.
Just about a couple months ago, Diabetes Foundation, they had called me, Dr. Prophet, send the message that they were doing the eye screening program, and I went and I had my eyes done, both me and my fiance, and I can say that I was well satisfied with what they did with the result. Right now the cataract is under control. I would say yes, that is very good. It's very good for diabetic.
For over 10 years, the Maria Holder Diabetes Center has been effectively serving the diabetic and pre-diabetic community of Barbados with a range of international standard health services, which include diabetic eye screening, vascular screening, nutritional advice, and consultations with diabetes specialists. So if you are listening to VOB right now and you have a diabetic related query, or you need to make an appointment, you can call 243-3937. You can also follow us on Facebook or Instagram. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, Republic Bank, and the Maria Holder Diabetes Center celebrating its 10th anniversary. Until next time,
drink more water. Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.
Dream a dream and watch it become a reality. You can do it.